welcome to the Australian Spinal Research Foundation. I'm here with Dr. Bruce Steinberg. Dr. Bruce is a chiropractor and he's also one half of Chiro Nerds. How are you today, Dr. Bruce?
Great. It's great to be here.
That's good. Bruce hails from the great state of New York, which is an interesting place to be at the moment. But what we're talking about today is actually, you've just recently completed a case series about anxiety. And I find anxiety to be a terribly interesting topic at the moment, given the global mood. So I thought we'd chat to you today about that and then have a bit of a discussion about chiropractic and mental illness more broadly. Does that sound okay with you?
Sounds like a blast. Let's do it.
All right, fabulous. So first of all, you had a case series involving 5 practice members. Now, they were 2 female, 3 male. They were ranging in age from 24 to 53. And you actually did the case report retrospectively, so after they'd been through their course of care. Is that correct?
Mm-hmm.
Talk us what happened with those 5 a little bit.
Well, it's one of those things. I had an interest in, anything that relates back to the nervous system. And, a few years ago, I went around talking about chiropractic and mental health. I said, let's start to collect data to see how people do under chiropractic care, just out of personal curiosity. And what I started to realize was, wow, when we apply this in a clinical setting, it's fascinating to see chiropractic's role in helping people who struggle with mental health issues.
Yeah. Now, it was interesting to see that the patients didn't necessarily present at your clinic for the treatment of anxiety. They came with other complaints. So, let me see. You had, they all did.
Actually,
yeah.
Yeah, they actually did. And some of it had to do with the fact that I gave a class that discussed mental health. And so they were kind of curious if they could be helped, not because we treat mental health disorders, but they wanted to see if their nervous system was playing a role in how their body was actually functioning. So yes, actually they did present with their chief concern of mental health issues.
Okay, so talk us through what happened. They were treated for vertebral subluxations. There was talk release. Yep. Talk me through the process with them.
Okay, day one, we take a detailed case history. We like to know what kind of events have led up to the point of where they are at that point in their life. What kind of stressors, the 3 T's, if you will. Mm-hmm. And after that, we get into the 3 techs. So we do utilize the thermal scans, the surface EMG, and also the heart rate variability. Yeah. And in my office, we also do a series of postural and neural evaluations. And after that, we do a set of full spine x-rays.
Okay. So now for the people that are watching at home, whether they're, chiropractors or not, the 3 T's, trauma, toxins, and stress, which is what we talk about as kind of causing vertebral subluxations, isn't it? And how, can you talk me through what the talk release protocol is?
Sure, absolutely. Just to go back to the 3 T's, one of the challenges in our profession is there are some that incorrectly say stress or the 3 types of stress causes a subluxation. Mm-hmm. When you put it through the philosophy lens, we got to be careful that we don't say that the stressor automatically causes subluxation. Okay. Is when the body cannot adapt to that. So just because some people, they say that, it's like, oh, time out, let's teach our practice members correctly, right? In regards to the torque release, that is my main assessment that I default to. It's not the only technique I do in the office. See, that's my problem. I'm a bit of a hybrid. I believe that different people need different care at different times. Mm-hmm. I do like the fact that, the upper cervical camp, I think, has it right. I think we need to go straight towards the upper cervical area because of its dramatic influence on the brainstem and cortical function. And then once we're happy there, we need to look at the rest, right?
Yeah. So the upper cervical area is this, isn't it? It's right up the top, right up near the skull.
Oh,
yeah.
Top, right at the top.
Right at the top. So we've got massive amounts of nerves going through that area, obviously, because it all comes from the brain. So, all right. So we've got trauma, toxins, and stress as linked to subluxation. We've got chiropractic as being important in restoring optimal neural function. You said something really important there, and it was about adaptability, our ability to adapt to stress. So when you gave that talk about chiropractic and mental health, how do they link?
It's simple. One of the first things I decided to do, because I saw the importance of it, was to delineate the difference between the salutogenic model versus the pathogenic model. We need to understand that they're not the same thing. And that's why, as chiropractors, we don't treat conditions, we don't treat anxiety, we don't treat depression, but rather we restore function in the human physiology. And when you do that, the natural outcome is health, healing, and well-being. So when people start to understand that concept, they go, oh, okay, so maybe that's why the medications I'm taking for depression are not working or no longer working. That's why they seek us out. They're looking for a different approach. And salutogenesis is that different approach. And that's the field we need to stay in as chiropractors.
Yeah. Now, salutogenesis, I've heard the wonderful Peter Kevorkian talk about this. I've heard Brandon McDonald talk about this. And salutogenesis essentially is building health instead of treating disease. Like, it's building up the substrates that allow us to function instead of just kind of chasing and attacking those symptoms as they come along. So it's really interesting to see a case series come along and look at this, because we don't treat conditions, but it's a beautiful thing when we see that outcome. So just reflecting on the world as it is at the moment, we've got huge amounts of people in lockdown in their own homes or unable to do the things that we would normally enjoy. Obviously, personal interaction, social connectedness has been an important thing for mental health and for building up well-being. What do you see as the role of chiropractic in this time in helping people deal with what's really quite a difficult situation in terms of pandemics and lockdowns and all that kind of thing? How do you see chiropractic as helping?
I think chiropractic, this is a crossroads. It's a vital time for us. We could really see our profession truly take its place in healthcare, being unique and distinct. It is all about salutogenesis. It is all about adaptability. For the people that are sitting there glued to their TV watching the news nonstop, that has the ability to trigger a stress response, because that is a form of a stressor. Yeah. If the body cannot adapt, they will become subluxated. I'm seeing that clinically in my office now. I've been blessed and I hadn't closed. I've been open this whole time. And so I started to see patterns change. I started to see people hold more stress in certain areas. And, as I'm doing HRV scans, I'm noticing, like, I think all but one person in the last month, they were all sympathetic dominant. Oof. With us knowing this is an important time for chiropractors to understand the science and teach it. And what our field of expertise really needs to be is the autonomic nervous system. Mm-hmm. So those of us that use scientific methods such as thermal scans and heart rate variability analysis, guess what? We have the ability to show people when they are not adapting, and even more importantly, provide a service that allows them to adapt to their environment, and they'll become healthier as a result.
Yeah, now this issue of sympathetic dominance is really quite a fascinating one, because sympathetic dominance, and I'm kind of trying to keep this all kind of layman language, is when you've got like a seesaw in that autonomic nervous system, and on one side we've got the fight or flight responses that kind of our survival mechanisms. On the other side we've got rest, digest, reproduce, repair, and that's supposed to be an adaptive thing, isn't it? But we can hold that stress in our bodies and keep the sympathetic side, the fight or flight, survival side, elevated. Can you talk me through how chiropractic helps that seesaw get back to adapting?
Yeah, 100%. I think it's kind of a challenge, because a lot of us like to use the analogy of the fight or flight, rest and digest, and then gas pedal, brake pedal. Uh-huh. For laymen, I think it's good enough. I like Stephen Porges' polyvagal theory, where he talks about that third layer, and that whole 3-layer system as opposed to 2 layers is important, because you mentioned people social distancing and such. When you talk about the word social, there is such a thing as social health. Social health, the ability to contact with another human being, eye to eye, touching, that requires vagal tone. And when you talk about vagal tone, you're talking about the parasympathetics, you're talking about the upper cervical area, you're suddenly bringing it back to chiropractic. So I think chiropractic has that ability to get people reconnected, balance out their nervous system, allow them to adapt. And guess what happens? Once again, optimal function, well-being. It's like the same story over and over, but it's beautiful. It makes so much sense.
Yeah, it's poetic. Now, you do an interview with Dr. Bruce and you tell him, I'm going to talk about a case series. And then he goes and mentions a hot button issue for me, which is polyvagal theory, to the dummies who haven't heard of it. Obviously, we're talking about the vagus, the cranial nerve that runs down here that connects the head brain with the gut brain. Talk to me about polyvagal theory. What is that?
Basically, they were talking about, there's these three evolutions of the vagus nerve. There's three ages it went through, an older one and a newer one. And, some folks like to link it to different parts of the brain stem, the midbrain, and then the front of the brain. And the ultimate version of it, or the newest version of it, is that social connection. But when we can't social connect with a person, we don't make that eye contact, and we're not in that safe place, we automatically default to that fight or flight, that stress mode, that anger, reactivity. And then the bottom one, which would be the oldest, would be when we're downshifting into that parasympathetic freeze response. Think of a lizard or a deer in headlights. And what happens is they freeze. Yeah. They can't respond. And unfortunately, that's not the best survival mechanism, but we do see that does occur in human beings, and it's expressed in different ways, which is really, not a good thing.
Yeah. So when we start to bring in chiropractic, and we know that the chiropractic adjustment can, especially in the upper cervical area, can stimulate that vagus nerve, and we can remove the subluxations. We can help people adapt. What we've got here, bringing it back to the case series that you wrote, which is clearly over on this side of my screen, ladies and gentlemen, is we've got 5 cases where people have actually seen improvements in their mental health, and they've seen lowered anxiety. So how do you measure that in a clinical setting?
Well, we first started off by measuring physiology. That's the test that we use, the HRV analysis, therm, and surface EMG. Yep. And then we also use the Hamilton Anxiety Form. That is a questionnaire that basically allows the person to themselves rank where they are in terms of how they respond to different categories of stress. Yeah. It's a questionnaire. It takes them under a minute to fill out. But what's fascinating is it gives you a snapshot as to how well they not just deal with stress, but where are they in the realm of anxiety specifically.
So this is something that chiropractors can use quite easily in their clinic, isn't it? If it takes less than a minute for somebody to fill out, you could just have them do it as part of their pre-paperwork or while they're waiting around, isn't it?
That's what I did. Yep.
Yeah. So in terms of, I like talking about case studies and case series. Obviously, a lot of them, it's important because it drops the breadcrumbs for larger studies to get done. But it also raises an important mechanism, and that is how we measure pre and post realities for people. And so the Hamilton Anxiety Form is a really easy one to use. Heart rate variability we've talked about before, and it's a measurement of how adaptable a person's nervous system is. It's interesting because you're using objective measurements like HRV with what could be subjective measurements, a self-reported questionnaire about mental health. Yeah. I mean, to me, it's simple. And not only that, but, a questionnaire like that, it's not owned by chiropractic. In other words, it's a questionnaire, an instrument that's used by any profession. And that's why it's widely accepted. And I think it's really great when we utilize methods like that, because in essence, they're universal. So people can't balk at it. They can't be like, oh, that's just, that's a chiropractic thing. It's like, no, it's actually a universal thing. And it's great to use. Yeah, and so heart rate variability is used outside of chiropractic as well. So that's and I know that we're kind of staking a claim on that, but it's a beautiful tool. So what's next for you and for Chiro Nerds and for just...
Well, Chiro Nerds is on the back burner right now. So what we're doing is just put it aside. It's something that I decided that I'm going to be running with. So I'm a party of one right now. We're going to keep that way for a little while. But what we're going to focus more on is trying to bring more education to the chiropractic profession. All of us have different strengths, and it's time to give the profession those gifts. As an example, one of the things that I did a few months ago at the Berkshire event in Puerto Rico, I gave a really unique talk, and it definitely turned some heads, because what I did was I gave a talk called The Neurology of Sex. And I talked about how chiropractic can help people with sexual dysfunction. And it's
I can see why
fascinating
it turns
because,
heads.
yeah, people are like, wait, what is he going to talk about? But what's interesting is, we do look at it from a cortical and subcortical lens, meaning the brain and below the brain, but it comes back to the same conversation as we're having now about chiropractic and mental health. We
Mhm.
talk about the vagus nerve, we talk about the brainstem, we talk about the parasympathetics, the upper neck. And when you look at the science, it's so fascinating because it explains why, gosh, yeah, we can help people with mental health disorders, even though we don't treat them. But
Mhm.
guess what? We can also help people with sexual dysfunctions. And it's not because we treat sexual dysfunction. So it's a pretty neat thing.
Yeah. So there you go. Perhaps the next interview we'll be doing with Dr. Bruce, chiropractic and sex. Tune in for that one.
Perfect.
Anyway,
Let's do it.
yeah, so thank you for taking some time to talk to us today. I've put a link to the case series below this video. Make sure you click on it, have a read. Dr. Bruce, Dr. Dave Russell, and Kate, I don't even know how to pronounce this name, Gordon?
Kate Gordon.
Yeah, Kate Gordon have collaborated on this one, and it's a really interesting one. Just simply how removing those vertebral subluxations has, using the torque release technique has resulted in some measurable differences in people's anxiety levels. It's a beautiful thing, especially at this time in history where anxiety is important for people. Thank you, Dr. Bruce. Tune in next time. See you later.